In light of a concerning rise in yellow fever cases across the Americas, the Ministry of Health, Wellness and Elderly Affairs has issued a public health alert. Dr. Michelle Francois is the national epidemiologist.
The Ministry of Health, Wellness and Elderly Affairs remains vigilant following the alert from the Pan American Health Organization of the recent increase in confirmed human cases of yellow fever in the region of the Americas. This increase was noted in the last quarter of 2024 in Bolivia, Brazil, Colombia, Guyana, and Peru, where approximately 50% of the total cases were fatal. In the first 4 epidemiological weeks of 2025, Brazil, Colombia, and Peru reported a total of 17 confirmed human cases, including 7 deaths.
As the situation develops, the Pan American Health Organization has noted a troubling shift in geographic distribution of the disease, now affecting areas previously considered low risk.
The most recent rapid risk assessment conducted by PAHO was aimed at assessing the potential threat of the increased yellow fever cases to public health in the region. It considered criteria such as the potential risk to human health, risk of dissemination, and the capacity to detect and respond within endemic countries. The overall risk of yellow fever outbreaks in the region of the Americas was classified as high, and recommendations given to strengthen surveillance activities, early diagnosis, and timely isolation and treatment. Yellow fever is caused by a virus, mainly spread to people through the bite of infected mosquitoes, but primarily the Aedes aegypti mosquito, the same mosquito responsible for the transmission of dengue, Zika, and chikungunya viruses. The incubation period, which is the time from infection until illness, is 3 to 6 days. Similar to dengue viral disease, the first symptoms of yellow fever include sudden onset of fever, chills, headache, general body aches, nausea, and vomiting. While most persons may be asymptomatic or develop a mild form of the disease, others may progress to a more severe form characterized by high fever, bleeding, yellow skin or eyes, and organ failure. There is no specific treatment for yellow fever, and management is based on presenting signs and symptoms.
With the Aedes aegypti mosquito prevalent in St. Lucia, the potential for local transmission remains a concern, especially for travelers returning from endemic regions.
If you are traveling to a country where yellow fever is endemic, preventative measures such as the use of mosquito repellent, wearing protective clothing, and avoiding being bitten by the mosquito during dusk and dawn, which are the peak biting hours for the mosquito, may reduce your risk of getting yellow fever. Vaccination is also one of the most effective measures in the control and prevention of yellow fever. The yellow fever vaccine is available in St. Lucia at the Leclerc and Vieux-Fort Wellness Centers, and if taken at least 10 days before the date of travel to an endemic country, will provide effective immunity against this disease. Since one vial contains sufficient quantity to vaccinate multiple persons, the public is encouraged to call their respective wellness centers to schedule an appointment. This will help to minimize wastage. St. Lucia has not recorded a confirmed case of yellow fever in decades, and there is currently no suspected cases. However, because the Aedes aegypti mosquito is present on island, the potential for spread exists if a returning national or visitor is infected. When making your travel plans, always ensure that you are aware of the risk of infectious diseases at your destination. By doing so, you can protect yourself and keep St. Lucia safe.
The Ministry of Health, Wellness and Elderly Affairs says it will continue to monitor the situation closely and provide updates as necessary. For now, residents are encouraged to stay informed and take appropriate precautions. Joachim Duplessis, HTS News Force.